Summary of the second section, Assessing Food Addiction. Introduction to Assessment Methods. The second section of the presentation focuses on the methods used to assess food addiction, highlighting the importance of accurate diagnosis in understanding and treating individuals who may suffer from this condition. The section is structured around the second objective, identifying 2 common ways to assess food addiction. Objective 2, Assessment Tools for Food Addiction. The key tool discussed in this section is the Yale Food Addiction Scale, IFAS, which was developed in 2009. The IFAS is a standardized self-report instrument designed to assess food addiction based on the diagnostic criteria for substance dependence. This tool is significant because it provides a structured method for identifying individuals who may exhibit addictive behaviors toward food. Yale Food Addiction Scale, IFAS. 1. Development and Purpose. The IFAS was created to fill a gap in the assessment of food addiction by applying criteria typically used for substance dependence to eating behaviors. This allows for a more formal diagnosis of food addiction, using a scale that reflects the severity of the addiction. 2. Structure of the IFAS. The scale consists of 25 items corresponding to the 7 substance dependence criteria outlined in the DSM-4. These criteria include factors such as tolerance, withdrawal, and continued use, despite adverse consequences. To be diagnosed with food addiction using the IFAS, an individual must meet at least 3 of these criteria along with evidence of clinically significant impairment or distress. 3. Prevalence rates. The presentation highlights that prevalence rates for food addiction, as determined by the IFAS, range from approximately 5 to 10% in general student and community samples. However, the rates are significantly higher in populations with obesity, where it can range from 15 to 25%. Among morbidly obese individuals or those with binge eating disorder, BED, the prevalence can reach 30 to 50%. IFAS 2.0 and DSM-5 alignment. 1. Update to DSM-5. The presentation notes that the DSM-5 introduced changes to the classification of substance-related and addictive disorders. Substance abuse and substance dependence were merged into a single disorder with a continuum of severity, ranging from mild to severe. Additionally, craving was added as a diagnostic criterion, and legal consequences were removed. 2. IFAS 2.0. In response to these changes, the IFAS was updated to IFAS 2.0 to align with the new DSM-5 criteria. This updated scale reflects the current understanding of addiction and incorporates the changes made in the DSM-5, such as the inclusion of craving and the application of a severity continuum. 3. Diagnostic thresholds. The diagnostic threshold for food addiction in the IFAS 2.0 requires the presence of at least 2 symptoms, plus clinically significant impairment or distress. The severity of food addiction is categorized as mild, 2 to 3 symptoms, moderate, 4 to 5 symptoms, or severe, 6 or more symptoms. 4. Validation and efficacy. The IFAS 2.0 has been validated and is considered a psychometrically sound tool for assessing food addiction. It has shown high agreement in identifying participants without food addiction, 91.5%, and moderate agreement for those with food addiction, 51.5%. Alternative methods of assessment. Clinical questioning. In addition to the IFAS, the presentation suggests a more straightforward approach to assessing food addiction, asking patients directly about the impact of food on their lives. Key questions include whether their eating habits have caused problems in their life and if they continue these habits, despite knowing the negative consequences. This method is less formal, but can be effective in identifying individuals who may need further evaluation or treatment for food addiction. Key points to remember. 1. The Yale Food Addiction Scale, IFAS, is a critical tool in assessing food addiction, applying substance dependence criteria to eating behaviors. 2. The prevalence of food addiction is higher among individuals with obesity, particularly those with morbid obesity or binge eating disorder. 3. The IFAS 2.0 aligns with the updated DSM-5 criteria, offering a validated and effective method for diagnosing food addiction. 4. Simple clinical questioning can also be a useful preliminary assessment tool for identifying potential food addiction.